Welcome back to Feeding Forward, ABM's conversations across continents on breastfeeding medicine. This special series was developed by the Academy of Breastfeeding Medicine in recognition of World Breastfeeding Week, a time when we come together to recognize the progress we've made and reflect on the work still ahead. I'm Nicole Wallace, the Executive Director of the Academy of Breastfeeding Medicine, and I am your host for this global storytelling series. Through these conversations, we're hearing directly from ABM members around the world about what breastfeeding medicine looks like in their region. We're talking about the successes, the challenges, and the ways that we can learn from one another. These aren't formal presentations. Instead, we've invited colleagues to share their insights in an open, reflective format, more of a conversation than a lecture. Today, we're traveling to the United Kingdom, where we're joined by Dr. Tijen Eren. Dr. Eren is a UK licensed medical doctor and trained general practitioner with a PhD in pediatrics. She brings more than 20 years of clinical academic experience, having worked extensively in child health, pediatric nutrition, and public health in both Turkey and the UK. She currently serves as the clinical teacher in pediatrics and trust registrar at London Northwest University Healthcare NHS Trust. She is also an honorary clinical teacher at Imperial College London. Her areas of focus include early childhood development, breastfeeding support, and medical education, and her work continues to shape healthier futures for children and families around the world. Let us begin with Dr. Eren. Thank you so much for joining us today.
Thank you for the great introduction, Nicole.
Absolutely. Well, to get us started, I always like to ask, if you can tell us a little bit about what brought you into breastfeeding medicine and early childhood development. Was there a specific moment that really shaped your path?
Yes, I can give you actually two moments, one of them being professional and the other one being very personal. So I think initially I fell in love with child and women's health when I was doing my government service as a part of my specialty training in Turkey. And I saw how I realized, I think, when you kind of are in the in the medical school and you're in the training, you don't really realize the real living conditions of women and children out there in the field. But when I was doing my service, it was a very deprived region in Turkey. It was towards the east, and I realized how much there could be done to improve child survival and women's access to hospital care. So that was my first, I think, motive to focus on breastfeeding, because when I kind of started reading more about child survival, I realized breastfeeding in itself is one of the most major interventions that we can do, which is very simple but quite effective for increasing the child survival rates for the first 5 years of life. And I was lucky enough when I then became a mother myself to kind of be closer to my professor, who was also my son's pediatrician. And she told me all about these concepts about child health advocacy, child health promotion, and then encouraged me to do the PhD on child public health and primary care pediatrics approach to child health. That's when I this training also reinforced the importance of breastfeeding, how it can really alter the course of both the infants and the mothers.
Wonderful. So it's a personal mission. What I hear is so very personal for you. And also that time and journey in becoming a mother and having to breastfeed yourself, that made it a direct personal connection, is what I'm hearing.
It did. And interestingly, Turkey is a country where breastfeeding is very culturally embedded. However, I think similar to many other countries, as medical doctors, we don't get much training in breastfeeding counseling at all. I wasn't familiar with the detailed physiology or the anatomy to kind of make all the process make sense to my head. That's why I also went through quite difficulty while I was trying to breastfeed my first son. But I think there's a science behind everything, and then it has to be taught. That's what I also try to do with medical students here in the UK, with breastfeeding modules and, informative sheets that they can just have a look, and then they know that they can change the lives of the infant mother pair.
That's a wonderful concept. There's a science behind everything. And if we approach everything that we do with that mindset of focusing on the science and the education, I imagine we'd improve lives in a greater way if we just focused on that simple statement that you made. There's a science behind everything.
And I also believe breastfeeding is slightly kind of like depreciated subject. But if the medical students and the trainees and then in the future consultants realize that it's all science-based, and then there's no reason why any mom, I mean, kind of very limited number of reasons why a mom should not be able to exclusively breastfeed her child until the age of at least 6 months and going forward to the UNICEF, goals. And so I think if as doctors and medical professionals we can improve our knowledge, then I'm sure it's going to reflect on the people that we touch the lives of.
Absolutely. A lot of what you're saying resonates for me personally as a
Mm.
mom who was breastfeeding, and my physician did not have the experience to support me properly, and went on a journey to learn and become educated. But it's one of those universal issues. You talked about your perspective from Turkey. I'm in the United States, and I'm a patient. Had a very similar experience to what you described. Well, let's talk a little bit about, what breastfeeding looks like in your region. You said Turkey, for example, you said it's very normalized as part of culture. How would you describe the practice of breastfeeding medicine? And I don't know if you can maybe contrast Turkey to where you're practicing in London and if there's any differences.
So I think that's a good question. In Turkey, when I'm talking about the moms who gave birth, we're coming from a culture that kind of supports breastfeeding, so it's not like a foreign concept. Whereas in Europe, I think it was quite, I don't want to say frowned upon, but the people had distanced themselves between the actual act of feeding the child from mother's breast, and bottle feeding was really thought very highly of. Um, so I think Turkey has a little bit of advantage in the sense of the perception of the new moms. And the government has done a lot as well. I think it's similarly, the government has tried to ameliorate the current status, beginning from early 1990s, and then they put in place many legislations in support of the breastfeeding friendly hospital initiative. The baby friendly health policies were adopted with a lot of enthusiasm. And quickly this spread a lot because the public really was very pleased with the hospitals that they got accredited as baby friendly. So I think initially there was a huge effort to get majority of the hospitals um, with the baby friendly accreditation. I'm not saying
Accreditation.
accreditation, yes. So once they were accredited, then some of the cities actually became baby-friendly cities. So I think Turkey is one of the success stories, and when it comes to the UNICEF application of the UNICEF suggestions and what they brought together as the certification and the national training programs. However, unfortunately, IBCLCs and the lactation consultancy, you cannot charge it. So if you give that consultancy on the side, you're not going to be able to find an ICD code to kind of turn that into something like that's kind of of financial value as well. So the healthcare practitioners will do it because to abide by the hospital, the baby-friendly status of the hospital. However, I think if it was like more kind of supported government wise financially as well, if that could be kind of seen as something that could also have fiscal worth, maybe that could be more motivational for people to take on more responsibility in the breastfeeding arena, healthcare workers wise.
So there's this limitation of, the knowledge and the expertise may exist, but you can't necessarily charge and bill for those services. And so, does it kind of get folded into general healthcare practice? Am I understanding that correctly?
Yeah, so I think it's a part of the package that usually the hospitals offer after delivery. So usually our discharge is slightly slower than the discharge period in the UK. So we will usually keep, even if it's normal delivery, vaginal delivery, we will keep 1 day or will discharge on the second day, whereas in the UK, immediate discharge is possible.
Mm.
With a C-section, we're going to keep the patients 2-3 days to make sure that everything is in place. That's why they get to see the midwife or the nurses 1 day or second day, and the baby gets weighed, and then they do have a lot of like a more knowledgeable information given to them in these following days. But that's not specifically just for breastfeeding. That's also diaper changing is there, taking care of the umbilical cord is there. So it's a part of a package that's not specifically for breastfeeding, unfortunately.
It's postpartum or maternal care immediately
Exactly.
after birth.
Under that umbrella, yeah.
Got it. Now, given what hearing you say that the baby friendly initiative and having that accreditation, there's more accountability in the hospital to make sure that they keep it or
Exactly.
that prestige. Is But breastfeeding medicine, is that recognized as a specialty in either? It's not. Okay.
No, not as a specialty, but I now see more and more because I work as an IBCLC and also I'm the country director for Turkey, and then I see that there's every more people want to become independent lactation consultants, and they want to be trained and they want to be board certified, so they do it out of their own initiative.
Hmm.
But I think it's still, regardless, quite popular, and it's becoming more and more widespread and accessible for the healthcare staff, because anyone who becomes a board certified lactation consultant then kind of spreads the word around and then facilitates their fellow colleagues, and then it kind of grows from there, like, branches out. So it's getting there, slowly but surely, I want to say.
Do you ever see a day where it is a recognized specialty?
Um, I hope so. Why not? Yeah, I think the Ministry of Health is open to suggestions, and they've done very reformative moves in the past few decades. So I don't see why not, because also it's something that's quite taken positively by the Turkish public, as it's kind of innately built in the culture and the customs. We are so much familiar that with the concept of, raising a child will take a village, and we are in favor of creating supportive communities, helping the moms. I think that's one of the other in the Western world and Turkey, because the bigger family concept is still quite viable. The isolated root, like the family of 3 or 4, is less seen. The extended family is still there to support. So that's also a very positive factor for the continuation of breastfeeding.
Wonderful. Now, what about ongoing support for you as a practitioner and for your colleagues? Is there education expectations and how, is that supported
Yes.
institutionally,
Yes.
ongoing education?
Definitely. So as I said, like it kind of branches out and spreads uh, from one colleague to the other and the other teams. Um, uh, when I was actively working there as a under the PhD umbrella, I was also one of the facilitators and this or an ongoing program at Istanbul University, where lactation consultancy was taught, and people were given certificates. So they became certified, not international board certified, but locally board certified by the university itself. And training that via a training that went for a couple of days and teaching all the bits and details of breastfeeding and how they can support the new moms and the infants and the difficulties that may occur and how to manage those.
Mhm. Now, you mentioned that parent and patient education and support is really uh, instrumental when they're in the hospital right after delivery. What about access? If I'm a mom and I'm having difficulty and I need support, how accessible is a breastfeeding medicine specialist or practitioner to me?
So I'd say not a specialist necessarily, but a person knowledgeable of breastfeeding will be available in their local family physician setting and also the hospital that they gave birth at. The government will also be sending, in the UK, they do send healthcare visitors. However, in Turkey, it's slightly different. They do have visits, but they can also come back to the institution and then ask for help. So their ties are not immediately cut with the hospital setting that they deliver at. There's there is no discharge with formula bottles. So it's really important that I underline that we are quite aware of the code, and our pediatrics groups vehemently support the code. So we try to also all the pediatrics specialists have put their foot forward to kind of limit um, the advertising of the formula before 6 months on any social media or TVs or via written printed media. So I think as much as well as the easiness of going back to the institution and getting care on the primary care setting, there's also less distraction from breastfeeding in the sense of aggressive formula marketing.
That's really powerful, that portion there. I think I was just conferring with a colleague. My kids are a lot older now, but in our pediatric practice, as I exit the building, there's a wall of formula and parents can just grab and go. So those
Yeah.
samples are so readily available. So it's very innovative
It is.
in practice.
It is. No, I think, yeah, it's just very, very easy to access formula. And then
Mhm.
it seems as if, like, it may seem to the patient who is being discharged, it's a better alternative, a quicker, like, why would you make the child suffer kind of approach, which is very subtle, but it's there. And, especially a new mom with a primiparous mom who just had a first child will be very susceptible, will also be more gullible than a senior mom who's had many children and knows how it's run and, has went through this process before. So the rates are quite different. If you want to talk about the rates and
Yeah, please.
yeah. So I think our rates of ever breastfeeding is quite high. It's in the higher 90th centiles. So It is still cited in the most recent statistical data that ever breastfeeding is 98%. So it's quite high. And then we do kind of monitor for the first hour. So our first hour rates are quite high as well. It's 71%. And however, the exclusive breastfeeding does taper off. And it tapers off. There's a very radical drop. Within the first month, it drops all the way down to 59%, and then all the way down to like 40.7% by 6 months. So it lingers there, like it drops very abruptly, and there's a steep decline in the initial months, because obviously, bear in mind, it's the period where infants will lose weight. There's a physiological weight loss, and that also scares parents a lot. And if they're not well communicated, these kind of information, then they kind of tend to supplement with formula. So the exclusive feeding is still there, but quite reduced at a 40.7% at 6 months, which is not bad, but the WHO target is 50%, so slightly lower than that.
Slightly lower, but probably more advanced than other nations from what I've seen in some of the reports from our breastfeeding committee here in the United States. So that's wonderful. Very remarkable.
Yes.
So given all of, it's culturally supported and very normalized in Turkey and from what you've described. And then when you contrast that to in the UK, what do you think are the pressing needs and opportunities?
So I believe, like in the UK, it's much easier to kind of get these trainings that are offered to the medical staff that will kind of make them give them the expertise to support breastfeeding are a little bit expensive. So I think they're more accessible financially in the Western world. So that may be an easier a barrier for medical practitioners here than back in Turkey. However, in Turkey, people are more determined because obviously the concept is so favorable and popular. And almost everyone agrees that this is the best option of feeding a child. So there's no adversity there. There's no differences in opinion. There's no clashing thoughts. And also, it's easy for a mom, as I said, to be supported by the extended family, to use public spaces, and they can breastfeed more comfortably. Whereas in more westernized countries, it may not be that comfortable to breastfeed in public. And very unfortunately, some people may even react. So maybe that kind of barriers are easier to tackle with by it always helps to talk about these things with the public, share information, just, be in a very friendly manner, and then kind of include everyone rather than create adversities.
The more focused on education, communication, and kind of a community.
Sense of community, very essential. So also, I think empowering medical students as well, because if they sow the seeds, then even if they see a practice that doesn't align with breastfeeding friendly initiatives, then they can pick on those easier. So imagine going through the entire medical school without being exposed to anything about breastfeeding, and then just being in the practice, and you're not going to be able to challenge the senior staff. But however, if someone has introduced you some of the key concepts in advance, then you will feel more empowered to call out things that don't really sit well with you. So I think, yes, goes back to education again, I think.
I think that's where it starts for everything, right?
Yeah, I mean, for me as well, I think it's just out of experience, it changed a lot for me, just being more knowledgeable, building my more in-depth knowledge. It changed my whole experience, and I had a totally different experience while I was breastfeeding my second boy. So It is possible, and it can be overcome.
Hmm.
So I think um, just with the right tools and using the social media, where I mean, which is also kind of quite aggressively used by the formula companies, I think we can use those tools as well.
Absolutely. That's a wonderful thought there. Now, as we kind of wrap up, what I'm hearing, I've spoke with Dr. Seo from Japan, and in Japan, she discussed that there's a generational shift. So that normalizing cultural norms that you described in Turkey that exist today, um, previously existed in Japan, but now not so much. Do you notice any generational shifts in either regions that you work in?
So I was also having a conversation with a friend from Japan, and she mentioned that now people are living like more independent lives, and the older generation is not necessarily very keen to take care of the younger generation.
Mhm.
So the new moms are feeling quite isolated. That's why they're reluctant to have children. And she was also worried about the growth of the population, which I think is an issue in several countries, isn't it? Because when the lack of support is there, then it can become quite challenging. It becomes even a bigger decision to have a child, doesn't it? So,
Mhm.
um, however, not in Turkey. Turkey is a very young population. And even though it may be stagnant in the growth rate in the recent years, there's still a lot of support available for the new moms, and the government is promoting having children, and they're offering support for families with one children, and then also more elevated support for families with two, three, or more children. So with different packages offered at different kind of family sizes. But still, I think economically, there's a global also trend that makes growing families uh, you just take a step back and you want to ponder a little bit longer before you kind of try to make a decision to expand your family, because everything comes at a huge cost these days, doesn't it? So,
Yes, with us. Yeah, that decision, there's so many factors that weighs into extending your family beyond, there's that economic factor, there's a support factor, and there's also capacity factor. So there's so many
yeah.
different factors that go into it. So it's very important.
But still,
Well,
I want to accentuate, I'm sorry to interrupt, to just breastfeeding is like the breast milk is there readily available. It is the cheapest actually way to feed the child, and also for environmental and social aspects of it as well. There's no carbon footprint, and it also ameliorates the mortality and the morbidity rates. So there's less strenuous for the society in general and the medical teams as well. So I think taking all these factors into consideration, breastfeeding does kind of peak and, you know, um, proves to be one of the best solutions for a young family.
absolutely. Wonderful. Well, Dr. Aaron, is there anything more you'd like to say to our viewers today?
No, I'm just very grateful I found this media to kind of come forward and share a piece of my mind. Thank you so much for giving me the chance.
Absolutely. So, thank you for joining us for this edition of Feeding Forward, ABM's Conversations Across Continents on Breastfeeding Medicine. We're grateful for Dr. Aaron for sharing her expertise on the landscape in Turkey and the UK and for contributing to the global dialogue that strengthens our collective understanding and practice. As we continue celebrating World Breastfeeding Week, we hope these conversations spark connection, curiosity, and shared purpose across borders. We invite you to tune in to our next conversation in the series where we'll hear from ABM colleagues from Mexico and the United States, offering insights from their respective corners of the world. Until then, thank you for all that you do to support breastfeeding families everywhere. All right. So
Happy Breastfeeding Week.
happy breastfeeding week.